As the number of cases of reported coronavirus, as well as the number of countries with confirmed cases increases, so does people's anxiety. It's very normal to feel anxious when faced with a public health emergency, particularly one such as coronavirus that is on the news daily and one that is associated with so many unknowns. A little bit of anxiety is not a bad thing, as it makes us conscious about the decisions we are making when it comes to our health and encourages us to be prepared. But when anxiety is disproportionate to the risk or begins to affect our ability to function, it becomes problematic. So, how can we manage anxiety associated with an outbreak such as coronavirus? 1. Educate yourself on what the virus is, what the signs and symptoms are, and the most effective preventative measures. 2. Keep perspective. Though it's important to stay informed, it's also important to keep perspective and not spend excessive time checking news or media channels. Remember to also spend time on other important and positive things in your life. 3. Don't inflate the risk. When something is new and there are some unknowns about it, it can seem very scary. This is our brain's normal reaction to a threat, our fight or flight response. And considering the amount of attention a new threat like coronavirus gets, it's easy for the risk to feel inflated. Take the time to consider the actual risk to you. 4. Take precautions. Once you've determined what's recommended as precautions, incorporate those into your regular routine. Current recommendations include typical flu protocols: washing hands regularly with soap and water, staying home if you feel sick, avoiding those who are presenting with flu-like symptoms, and maintaining regular health routines like sleeping enough, eating healthy, and exercising. 5. Stay connected. Having a support network of people to talk to when you're feeling anxious can help you feel grounded and remind you to keep the perspective you need. 6. Use your coping skills. If you experience anxiety in other areas of your life, remember to engage in practices that help manage your anxiety levels overall. For example, engaging in regular mindfulness practice. And 7. Seek extra help. If you're still struggling with your anxiety or experiencing panic that's affecting your ability to maintain your regular activities, you may consider seeking additional support. Remember that outbreaks like this happen from time to time, and many organizations are working hard towards finding solutions and answers to all of our questions, as well as working to prevent the spread. Of course, being anxious is normal, especially if you're in an area where infection rates are high. But remember to keep perspective. For example, in Canada, as of the end of February, there are only 9 reported cases and death rates are very low.